Your healthcare needs are unique to you, so you'll want a health plan that will flex with you to provide care to help you enjoy your best health, and a company committed to you. Humana supports you beyond what you'd expect from a health plan, like helping you find the right doctor for you and looking for ways to save you money. It's all the large and small ways Humana works to help members feel their healthiest. We call it Human Care, and it lives in all of our plans.
We're here to help you get the Medicare coverage that fits your life.
We'll walk you through all the information you need and help you enroll in the right plan for you.
If you're new to Medicare, it's important to know when you're eligible to enroll in or change your Medicare plan. There's a pre-enrollment period beginning October 1st, when you can learn about and compare Medicare Advantage and prescription drug plans for the next plan year. Enrollment periods are the specific times a member may enroll in a new plan and/or disenroll in a plan or make changes to their plan. You can enroll in Medicare in the 3 months before and after you turn 65. That's your initial enrollment period. The initial enrollment period for Part D drug coverage is generally the same as for Part A and Part B. The annual enrollment period for Medicare Advantage and prescription drug plans is October 15th through December 7th. During that time, you'll learn about your options and can enroll in a plan or change to a new plan. However, it's important to know you should not submit your application before October 15th. During the rest of the year, if certain conditions apply, you may qualify for a special enrollment period, a time outside the usual initial enrollment period, annual election period, or Medicare Advantage open enrollment period when you may elect a plan or change your current election. Ask your licensed Humana sales agent if you may be eligible.
Let's think about your Medicare options. Option 1 is Original Medicare, Parts A and B, through the Centers for Medicare and Medicaid Services. Parts A and B help cover many hospital and doctor costs, but they don't cover prescription drugs. With Original Medicare, you may need a separate Medicare Part D prescription drug plan, or PDP. If you do not select a Part D plan when you're first eligible, but enroll in one later, you may have to pay premium penalties for as long as you have your prescription plan. Creditable prescription drug coverage is prescription drug coverage that is expected to pay at least as much as Medicare's standard prescription drug coverage. With creditable coverage, Medicare beneficiaries have the opportunity to receive subsidized prescription drug coverage through the new Medicare Part D program. If you go 63 days or more past the end of your Part D prescription enrollment eligibility without Medicare drug coverage or other creditable prescription drug coverage, and then enroll in a prescription drug plan, you may have a late enrollment penalty. Most Medicare Advantage prescription drug plans are subject to a coverage gap, when you may pay more for prescriptions before more prescription drug coverage kicks in. If you think you may need help covering your drugs, you may qualify for the Extra Help program through Social Security.
Now that we've discussed Option 1, Original Medicare, Parts A and B through the Centers for Medicare and Medicaid Services, let's talk about Options 2 and 3. Option 2 is Original Medicare plus a Medicare Supplement Insurance Plan plus a prescription drug plan if you need prescription drug coverage. A Medicare Supplement Insurance Plan, also known as a Medigap policy, helps pay some of the costs Medicare Part A and Part B don't cover, such as deductibles and coinsurance. But Medicare supplement plans don't include prescription drug coverage. So if you take prescription drugs, you may need a separate prescription drug plan. CMS prohibits combining a standalone prescription drug plan and a Medicare Advantage PPO even if the plan doesn't include prescription drug coverage. But you can combine a standalone PDP with a private fee-for-service PFFS plan.
Option 3 is Part C. In order to enroll in a Medicare Advantage plan, you must have Medicare Part A and Part B and live in the plan service area. With or without prescription drug coverage, Medicare Advantage plans have all the benefits of Original Medicare. Plus, they may also have extra benefits, such as Go 365, Silver Sneakers fitness classes, and meals delivered after a hospital stay. These offer the advantages of greater comfort, convenience, and individualized care. Your licensed sales agent can tell you more.
One plan, one company. Simple. Keep in mind, you cannot enroll in a Medicare Advantage plan and standalone prescription drug plan too. If you want to enroll in a Medicare Advantage plan and have your prescriptions covered, you need to enroll in a Medicare Advantage plan with prescription drug coverage, or MAPD, which are offered through private companies like Humana.
Our members have access to Humana's Find a Doctor tool. It has a database of all the physicians in Humana's network. To make it easier to compare and choose, many doctors are also given a rating, which is based on quality of care and cost efficiency guidelines. That's called the Care Highlight Program. Clinical quality is indicated by the use of hearts. 4 hearts is the highest rating, 1 is the lowest. No rating means that there is not enough information to rate the doctor, or the doctor is in a specialty or geographic area where ratings are not available. Similarly, cost efficiency is indicated by the use of badges. 4 badges is the highest rating, 1 is the lowest. Together, 4 hearts and 4 badges means that doctor has the highest possible rating. Care Highlight ratings have helped Humana members across the country make more informed choices about their care. And Humana is proud to have earned NCQA accreditation for this useful program. Along with your Original Medicare Part B premium, you may have to pay an additional premium for the Medicare Advantage plan through Humana. Ask your licensed sales agent about $0 premium plans that may be available in your area. Premium price is important, but there's more to consider when you're choosing a plan. A good place to start is by thinking about your current plan. Ask yourself a few questions. What type of plan do you have now? What do you like about it? What would you add to make it even better? Is someone helping you make healthcare decisions?
Let's look at a Preferred Provider Organization, or PPO. With a PPO plan, you have a large, nationwide network of doctors, specialists, hospitals, and other providers available to care for you. You can also choose to see out-of-network providers that accept Medicare without referral. With our PPO national network, you get in-network coverage across the country for any doctor who accepts the plan terms, so you can travel easily or split your time between locations.
All Humana Medicare Advantage plans include a network of providers, some of whom offer virtual visits or telemedicine. This enables you to speak with an in-network medical doctor or behavioral health specialist from your computer, tablet, or telephone. You may use our Find a Doctor tool to select a doctor who's right for you, including telehealth providers. The providers in our network agree to accept a discounted rate from Humana. But unless you need emergency or urgent care, choosing an out-of-network provider may cost you more.
Now, let's talk about something that may be important in your planning: prescription drug coverage rules for PPOs.
If your PPO includes prescription drug coverage, you'll want to have your licensed sales agent review your plan's prescription coverage and specific drug list, also known as a formulary, or the medicines the plan covers, with you. Even if your medicines are listed, Humana may require you to try certain drugs first to treat your health problem before we'll cover more expensive drugs. This is called step therapy. Some prescriptions require prior authorization from Humana. That means your doctor must get approval from the health plan before prescribing a particular medicine. Manufacturers must agree with CMS's terms and conditions to contract with Medicare, so not all brand name drugs may be covered. In the coverage gap, you pay part of your drug costs before additional prescription drug coverage kicks in. In 2023, you'll pay no more than 25% of the cost of many generics and brand name drugs during the coverage gap. If you think you may have trouble paying for your medicines, you may qualify for the Extra Help program through Social Security. This is also known as the Low Income Subsidy. It's a program that lowers prescription drug costs for people with Medicare who qualify. If you have both Medicare and Medicaid, you may be eligible for another type of Medicare Advantage plan with prescription drug coverage. Ask your licensed sales agent if a dual-eligible special needs plan is a good choice for you.
Now that we've talked about when to sign up, your Medicare options, PPO plan specifics, and prescription drug coverage, let's get you ready to enroll. Your licensed sales agent will go over 3 important enrollment documents. One is the summary of benefits. The others are the plan's star rating, a 1 to 5-star quality measure of Medicare Advantage beneficiaries' experience with their health plans and its drug list if it includes prescription drug coverage.
If you sign up for a Humana plan, we'll send your ID card in the mail. You can choose to receive other plan documents online. If you decide to go digital, we'll email you a link to activate your secure online account called My Humana. By providing your email address, you authorize Humana to send you health information at this address, so it's important to let us know if your email changes.
You'll complete a health risk assessment by phone or online if you've chosen our online option. This is to see if you qualify for any special health programs, and be sure to attend a member orientation. We've covered a lot of information today, but if you have questions, contact your licensed Humana sales agent. Another great resource is the Medicare and You handbook you should have received in the mail. You can also go to www.medicare.gov.
At Humana, if it matters to you, it matters to us. That's human care. Thank you for your time and interest today.